Already, the violence has taken a terrible toll on health. On top of the number of deaths and injuries caused by the conflict itself, WHO expects there will be many more deaths due to outbreaks, lack of access to food and water, and disruptions to essential health services, including immunization. WHO estimates that 1/4 of the lives lost so far could have been saved with access to basic hemorrhage control. But paramedics, nurses, and doctors are unable to access injured civilians, and civilians are unable to access services.
When lab workers are forced to leave a laboratory and untrained people enter that laboratory, there are always risks. But the risks are primarily to those individuals, first and foremost, to accidentally expose themselves to the pathogen. But right now, the vast majority of people who've been infected with infectious diseases in Sudan are doing so because they're having to drink dirty water. They're doing so because they're crowded into basements and unable to access care. They're doing so because vaccination is not happening in young children. So when we look at biologic risks, as you put them, the main biologic risks to humans in Sudan is the fact that there's an ongoing conflict, there's ongoing war, and the denial of public health and health services to that population is what represents the major risk to health and the major risk of infectious diseases.